My name is Mark Darrow. I practice prolotherapy. I've treated thousands and thousands of patients over the years. The reason I do prolotherapy, it worked on me and it works on my patients. Prolotherapy is a surgical alternative that reduces or eliminates pain. We inject the area of the injury, typically with dextrose and lidocaine, to stimulate an immune response to bring cells to the area and rejuvenate the tissue. The advantages of prolotherapy over surgery are many. Number one, it's less invasive. Number two, it's less expensive. And number three, there's virtually no recovery time. The video you're about to see contains prolotherapy in action. If you have any questions, feel free to contact me at 1-800-REHAB-10 or my website, www.drdarrow.com.
Tennis player. I currently play for Loyola Marymount University. I played 2 years professionally on the pro future circuit. I recently had a broken wrist and I had surgery on that wrist and it wasn't healing quick enough. The pain was just too much from the scar tissue and the messed up ligaments and tendons. So I was referred to Dr. Darrow by a friend. You know, I wasn't sure about it at first and it sounded a little questionable, but once I started doing it a few times and it started to get results, then immediately I was sold on it.
This gentleman is a 23-year-old high-level collegiate tennis player who suffered a fracture in his right wrist several years ago. On presentation, his wrist was stiff and sore, and when I did an x-ray, I found that there was a metal pin through the scaphoid bone in the wrist. But his pain was not as much in that area as it was where the triangular fibrocartilage is on the part that I'm injecting right at this moment. And I've had very good success with prolotherapy with fibrocartilage tears like this, and after MRI we've actually seen repair of these. Some people go to surgeons and they want to do surgery on this, but the results are not all that promising, so patients then come in for prolotherapy, which is a fairly conservative procedure. As you can see here, it's tolerated very well. You can see the smile on my face, and this patient and I are joking together while he's getting injections. The reason athletes love prolotherapy is because it gets them back to their game fairly quickly. Studies show that when you inject similar ligaments in the back, the diameter of the ligaments thicken up by about 50%, and the strength of the ligaments become approximately 200 to 400% stronger. There's minimal recovery time after prolotherapy on any part of the body. Typically there may be a little bit of stiffness that resolves within a couple of hours or sometimes up to 24 hours, and patients typically will go back to work. I have personally gone back to doing sports the same day after I've injected my own body.
He basically just injects you with this mixture of lidocaine and dextrose. For the most part, it's relatively pain-free. I mean, it just goes straight in and out and takes seconds to do, and you're done, and then you're on your way to recovery. For the most part, within 24 hours, it's pretty much gone, and you're ready to rock and roll.